Hi, it's Tiffany Matthews, the patient guardian. I have returned and I kind of figured that I'm telling you all about advocacy and how what it does and different kinds of things, but I'd like for you to know exactly what it is and how it works and what it can do for you. So, having been a healthcare social worker for many, many years, I've seen a lot of things happen that really didn't have to. Sad to say, but it's true. It didn't have to. And what I want you to know is during those situations that don't have to happen, you can exercise your power or your customer power, even. I call it patient power, but you are customers in the healthcare system. And let people know, wait a minute, I'm not just going to be pushed along here. I'm a human being. My healthcare is worth everything. Go in with that attitude and you will win. You will win. It's time for patients to stand up as well as their loved ones. It's time for everyone to stand up and disrupt healthcare, disrupt the status quo, disrupt how healthcare is being delivered, disrupt all these costs. The costs are insane, even for people that don't have money. When you have to choose between your medication and food, that is a major, major problem, and it's been happening for years. So, how can patient advocacy help with all of those situations? For the time being, ladies and gentlemen, I think healthcare costs are going to be what they are. There's really no regulation as far as insurance companies to put a cap on premiums. There just isn't. And I think, when premiums do go up, people want people to blame, and a lot of it could have a lot to do with our government. A lot of it can have a lot to do with insurance companies and what profits that they're responsible for so they get noticed on Wall Street. Yeah, I said it. Well, I'll tell you, in order to combat what healthcare is costing you, you've got to get a better return on your investment. You have to make sure that when healthcare is delivered to you, it's in a respectable, understandable, and actionable way. Respectable, understandable, actionable. If a doctor's talking to me and he's not telling me my part of what I need to do, how am I going to help? I'm the patient. Respectable. If the doctor is talking down to me or the provider is talking down to me, I don't receive that very well. So what I'm going to do is focus on how the message was delivered versus the message itself. I'm human, I'm sorry. But and understandable. There are a lot of doctors out here that like to use doctorese and, oh, it's a contusion, it's a laceration, it's a bruise and a cut. Okay? Have them speak at a level that you can understand. Have them speak in a way where, oh, I get it, is in your mind. Also, in disrupting healthcare, one thing that you need to know in acting for yourself as an advocate or a champion for the cause of the patient, which could be you or a loved one or someone you care for. For example, as a parent, I am advocate for my daughter. All she's interested in is in her iPhone, and her friends. She doesn't know how healthcare works. Good for her that she has an advocate as a mom who will speak up and who will say, that doesn't make sense to me. Or you need to go over that one more time. These doctors, you get in a good 5 or 7 minutes with them. So you have to be prepared. You have to know what you're talking about, and you have to have good questions and concerns about yourself to ask within that time. The way I teach people to advocate for themselves, it's under the status of how healthcare is now, and that's not great. But there is hope in learning to advocate for yourselves. So, with patient advocacy, again, it is championing the cause for the wants and desires of a patient while they're in the healthcare system, be it an appointment, a hospital stay, a procedure, any one of those things where the patient is kind of lost or has questions or feels like they're not being treated in a respectable way. That is where an advocate can help. And again, it doesn't necessarily have to be a professional advocate. It could be a friend, it could be a family member. But you would want them to know how to communicate with doctors to get the results that you're looking for. For example, if you want more education, and I preach education as being a part of being a powerful patient partner, you must educate yourself on your conditions, facilities, providers, medications, all of it. But if someone is there and doesn't understand that, it's a good thing to have someone who knows what questions to ask, who knows how to communicate with doctors to get the communication you need to move forward and understand your treatment plan. That's what advocates do. And there are many different kinds of advocates. There are advocates for medical bills, thank God. There are advocates for specific diseases like cancer or dementia or heart disease, all of those diseases, which I completely can't stand and wish they would go to the pit of hell. But I digress. There are patient advocates, nurse advocates, nurse navigators in hospitals, and I applaud them for what they do. However, if they're not independent, so their paycheck comes from that facility. So what they have to do in being a navigator or an advocate in a hospital or a nursing home is protect the interests of the facility they work for. I am an independent advocate, and I don't work for anyone at all but for patients. Patients are my main concern, my main goal. Making sure that they have what they need is my mission. The mission, it's part of my mission to revolutionize healthcare in this country so that we create a nation of powerful patient partners. In numbers, if we go in and we know what we're talking about and we demand better care, healthcare would have no choice but to change. No choice. That's what you're paying good money for. That is exactly what you're paying good money for. And you have to assert yourself. But you do have to learn. It takes effort. And I'm here to help you every step of the way through LBB's products and services. I am here to help you. Please visit lbbhealthcareadvocacy.com and take a look at what I do. And again, if you don't get help from me, that's fine. But if you need an advocate's help, please hire one. That small investment in the advocate can save you a lot of time, stress, and heartache later on down the line. You wouldn't take your car to, a pharmacist to get fixed. A pharmacist, is professional. They can help you, but not with that particular situation. So in order to do your best by your own health care, hire an advocate to help you. They work on many different things, and many are independent and private, like me. So, just wanted to let you know what advocacy does. The benefits are amazing. Better patient outcomes, less time, stress, and money involved in your healthcare journey. Learning how to advocate for yourself is one of the best skills you can ever attain, because you'll be able to stand up for yourself, ask the right questions, of providers about whatever is going on in your treatment and be an active voice in your treatment instead of being shuffled around like healthcare would like for us to be. Doesn't work with me or anybody that I work with or care for. I'm all over it like a pit bull with lip gloss. So, again, I'm Tiffany Matthews, the patient guardian, and I'm here to help you with your healthcare journey. Please visit my website to learn more, lbbhealthcareadvocacy.com, and while you're there, you can get a free gift and you can sign up for a consultation with me for free. It would have a value of $497. I don't really care about that right now. I want to spread the message of patient power. So give me a call. Actually, set up a call with me at Calendly, CALendly.com/LBB/call. It's easier to do on my website. So go to lbbhealthcareadvocacy.com. I thank you for listening, and I hope you take your healthcare into your hands. Patients and caregivers, it's time to take a stand. I'm Tiffany Matthews, the patient guardian. Bye-bye. Yours in health.